Hi, so as Sophie said, I'm Esme and I'm a third year medical student at Newcastle University. I'm really happy that I've got the opportunity to talk to you here today and to tell you what it's like to be a medical student with chronic and rare diseases. So, for as long as I can remember, I've had constant vague symptoms and issues. These were pretty mild in my childhood, where I had joint problems and urinary problems. But things didn't settle, so my parents took me to the GP. They noticed I was really hypermobile and they said, we think you might have Ehlers-Danlos syndrome. That's a connective tissue disorder, and this was suggested when I was 6. All of my symptoms kind of continued and progressed and got worse the older I got, and eventually I did end up being diagnosed with Ehlers-Danlos. I was also diagnosed with mast cell activation syndrome, gastroparesis, and a neurogenic bladder. But it did take 10 years from when I was initially suggested that Ehlers-Danlos could be a thing to when I was actually diagnosed. And in this interim period, I did face a lot of gaslighting from healthcare professionals who seemed to believe that an absence of a diagnosis meant that there was an absence of anything actually wrong. And even with my diagnoses, I do still get dismissed. So it will probably come as absolutely no surprise to you that being a medical student is incredibly busy. There's an intense combination of academic work and full-time clinical placements, which is mentally and physically demanding. You add in exams, and that would be difficult for anybody, but especially for somebody with disabilities and chronic illness. So that brings me on to life with chronic illness. Not necessarily pretty. So this aspect of my life is also very busy and can be very overwhelming. I have to set up feeds, prepare medications, prepare injections, and administer those multiple times a day, which can add, 2 hours into my day sometimes. It's also very rare that I have a day where I don't have to go to an appointment or phone a specialist, phone my GP, speak to the nurse, organise a medical delivery, all of that sort of medical admin. And the burnout can be a bit exhausting, but unfortunately I can't take a day off from being my own doctor. So the combination of what feels like 2 full-time jobs is, a difficult one, and it takes a lot of perseverance. I have had people doubt my ability to do my studies and become a doctor purely based on my physical health needs. So I found that these doubts make it even more vital that I work to show people that chronic illness and rare disease doesn't actually mean a lack of ability, and I think it's enhanced my medical practice. So my lived experience allows me to have empathy for my patients in a different way to most of my peers, because I can understand the fear of being unwell and admitted to hospital, because it's happened to me so many times. It also just helps me to realise that you really need to listen to what your patients are saying, strive to address their concerns, as opposed to just dismissing it if there's no clear and easy answer. So I recently treated a patient who had an NJ tube like myself, and she'd been told by the consultant it would be a real barrier. So she was actually really happy and surprised to see somebody with a tube coming up, doing her bloods and chatting to her. Now, there are thousands of healthcare professionals out there with disabilities, and many of them are too scared to disclose them because they worry about the treatment that they'll get. So there's still a lot of work to be done to address these inequalities, but I'm proud to be able to prove that you can be a healthcare professional and be a patient and not be one or the other. My connective tissues and my organ systems definitely don't function as they should, but that doesn't mean that I can't help my patients and be an asset to the healthcare system. So thank you very much for listening, and I'm happy to answer any questions.